Paso a Paso podcast.
Oh, should I stop eating?
Doesn't matter.
Okay.
Here we are. Welcome to another episode of the Paso podcast. My name is Miles. Happy to be here with you as always. And we are wrapping up 2020. Different sort of episode today. We've had quite a wide variety of conversations this year, which I'm really grateful to have been able to foster, support, and collaborate with various folks on. Today, we are interviewing a mother in Taos who happens to also be my wife, and our nearly, 1 3/4-year-old child is right next to us as well. Mike?
He's about 19 months.
19 months.
Nearly 20 months.
So he's here, and I wanted to spend today maybe discussing a little bit about parenting during COVID in Taos. Of course, no matter who we were to interview, though, there would be other side stories that are related to the individual experience of that person. We'll get into some of those as well. So would you like to introduce yourself, and thanks for joining us today?
Sure. Hi, I'm Siobhan Bonnie O'Rourke, and I'm a mum here in Taos. To Roscoe, and Miles is my husband, and I'm from Tasmania, under Australia, and we met in Australia a few years ago, but we live here now.
Cool. And just to kind of get things rolling, what is, if someone were to say, what's it like parenting during COVID-19 in America, in New Mexico, in Taos, in the year 2020, what would you initially say about that? What would be your summary to start us off with?
It seems like a pretty unique experience, in the sense that, this pandemic is unprecedented in our lifetimes, anyway. So life in general for everyone is very different, especially here in America, because it's so affected by the pandemic here. So
what about for you? First person.
For me?
Yeah. What's your experience been like as a mother?
I guess in some ways it goes with the experience of being a mum, in the sense that you're probably going to, unless you're working or something, if you're a stay-at-home mum, then which I am, you're going to be at home quite a bit anyway. But because of the pandemic, I guess we're at home probably, more than we would be if it wasn't going on. And I guess the biggest challenge for us with that is just the socializing aspect, because I'm pretty social, and so is Roscoe. Like, he's a pretty social little guy, and so I would like him to be around little kids a lot. We have a mum baby group, which is amazing, and we try and do what we can with that, trying to be COVID safe.
Yeah.
But now that it's winter, like, that was mostly a outdoor hangout, I guess, at this year.
And there was today's scheduled, you said, with that group of
they do certain things. But then because of the weather, like, I guess
it's getting cold.
Yeah, it's snowing outside. I'm not from this kind of climate.
Well, that's a great segue, because I was going to say also your experience here is reflective of the fact that you don't have family here. Mm-hmm. So a lot of people that are native to Taos or Taoseños and grew up in the region have family that can either help watch kids or other cousins. And you have those things, and so does our son, but they're not here, aside from their sisters, which he does spend time with sometimes. And also the group of parents that you hang out with in Taos may share that, in that most of them aren't also from this region.
Not many of them, I don't think, are from here. Or if they are, they've kind of, maybe they were from here, then they spent time away, and then they came back. But I guess that is something that is shared in that group, and it's really been amazing to have that group. It's really supportive for the mums and babies. It's great to get babies together and then for the mums to be able to hang out as well. Like, I think the first year, so in 2019, it would be like a weekly meetup and then no COVID. So that was great, especially having like a pretty new baby and being a new mother. That was amazing. And we met through various local things, actually, like local groups to do with breastfeeding, pre-birth classes, art classes to do with, I think some of them were through First Steps, and some of them were through like the midwives that, you know, a lot of us were all seeing.
Yeah. And the Taos Loves Kids was one of the groups you met some other parents through that you're still in touch with.
Uh-huh.
And I guess what's cool about it, that is you ended up meeting parents who are going to have kids that would end up being the same age.
Roughly, yeah. It's probably like thanks, Roscoe. It's probably a range of like maybe 2.5 down to like 3 months.
We talked a little bit. There's lots of curious activity around us, as
Roscoe, no.
any of you that are parents can understand. We were talking before we started this discussion recorded here about basically the differences of what services and culture may exist here in Taos or in New Mexico for having children, whether it's the birth process and support for that or actually raising the child afterward. What's your impressions of having and raising a child in Taos with respect to the services that are available? There's obviously a lot of things that are here that are supportive and maybe some things that don't exist just because of the country we're in. But is there anything you'd like to share about that and your experience?
I mean, personally, I had a really great experience of pregnancy and birth. And I like that this community seems to be one where there are options with the way that you want to have a baby. Because there's Holy Cross Hospital, and then there's various midwives who can do home births. There's a Taos midwifery clinic, little smaller centre. So to me, it feels like there are a range of different options. I mean, of course, there are different prices, and so they're not accessible to everyone. You know, so
I
that's a factor.
I think some of them actually do take Medicaid though too, but it is.
True.
It's not consistent. Right?
Yeah,
the experience and the options available to people are not consistent. It depends on what insurance you have and when's it going to be and who's available and how do you even find out about these options. You know, this podcast is for Paso Network, and there's certainly a large effort there to share options here. But not everybody that provides services for young parents or new parents of young children are a part or engaged in Paso, and hopefully we can improve that over time and welcome the diversity that exists in our community and have there be more collaboration there. Just for perspective, you know, a lot of times in your experience here as a mother and as an individual, it's easy for you to share perspective on how things would be different if you were in Australia in the same situation. You have never had a birth or kids in Australia of your own.
Correct.
And so it's hard to know exactly, but what would you like to share about that? Because I know that through the years you've also probably had to get good at not sharing. Because it can sound like either bragging or complaining. Yeah. But what is your perspective on all that as far as young motherhood and what you've heard from? Because you have friends who are parents there.
True. I mean, in Australia, there's more of a universal healthcare system. Is that what you would?
That would be a good way to,
Like a lot more things are free to everyone.
So your health insurance, I'll try to interpret a bit. Your health insurance is not tied to your job. You don't even have to. So as a, beginning point, people don't have to have insurance to get care in Australia. So if you're born there, I don't know all the ins and outs, but if you're born there, you get a Medicare card, I'm pretty sure. Or, if you can apply for one, whatever. Right, which might be our Medicaid.
And so everyone gets that if you're an Australian citizen.
Yeah.
And then that's what you would use if you have to go to the doctor, go to the hospital, whatever. And the majority of I don't know because I've never had any major, surgery or anything like that. But I've never had insurance in Australia. And I've, you go to the doctor, maybe quite a lot because it's not that expensive to do that. So you keep up with your general health.
Was it free?
To go to the doctor?
Yeah.
Yes. But it gets a little bit complicated because it depends on the doctor. There's certain things called bulk billing. There's various things. So some doctors with your Medicare card, completely free. Other doctors, you might have to pay like $20 or something when you go. So there's variation.
So that's kind of like our copay.
Maybe, yeah.
But you have a sense that there's a more widespread availability of healthcare.
Yeah.
That's less difficult to obtain or
definitely. Could you get that out of his mouth?
Yeah. Share what else you'd like.
Yeah, I guess there's also... So as far as bigger things, as far as I know, I guess what I was surprised by when I first came here is seeing people doing like crowdfunding for surgeries and stuff like that. Like that is not something that I've ever seen before. I've never heard of anyone, being in debt because of their medical bills. Right. That's just not a thing
that's
that I'm used to at all.
And then thank you for sharing all that. When we look back at being giving birth or stuff like that, are there any stark differences you can tell or you're aware of based on speaking with your friends who've had children in Australia as far as how that is to be a mother in that situation?
So I guess a lot of people I know who don't have insurance in Australia, there are public hospitals that you can give birth in, and as far as I know, it's pretty much free. And so that's a huge difference, I guess, from having to pay.
Do they still have to pay for childcare or early childhood education opportunities?
I think it depends because there are the public systems, as far as I know, are relatively free.
Yeah.
So public schools, public this, public that.
Is there public early childhood like pre-K? That's free?
I've never had a child there, so I haven't researched these things.
Oh, good.
But I would think yes.
Yeah.
Yeah.
All right, quick break.
Okay.
Well, as with any parent of a young child, there are responsibilities that come with that ongoing and never-ending. Is there anything the young child would like to say?
What would you like, Roscoe?
Let's put on the headphones so that you can.
What would you like?
Jump on in as well. Our youngest citizen, as Taylor would say,
what would
or
you
Nikki.
Like? Milk.
You want to say hello?
Do you want some milk?
No.
He's been saying milk, milk, milk.
Very shy on the mic.
Yeah.
Well, we're going to take a break here. Let's see. Am I still? Yep. We're going to take a break here and finish up this segment. We will continue next time with Siobhan.
Plenty to talk about on these topics.
That's right. So we will continue to do so. Hope you're doing well out there. We very much appreciate not only the funding from the RT Keeler Foundation, but as well as the simulcast distribution through KNCE 93.5 FM in Taos, New Mexico. Thank you to Howie and everybody at the station for being willing to air these, and thanks to you for listening. If you or anyone else in your life have questions about how to access services for young children or the parents of those or grandparents, you can reach out to Paso Taos at gmail.com. I'd be happy to do some research and get back with you as I answer that email. Also, there is a Paso Taos on Facebook, Instagram, Twitter, if you'd like to reach out that way or stay in touch and follow us there. And this is a podcast as well as being aired on the radio in case you were hearing it on the radio. So check out the podcast app on your phone. If you're new to podcasting, just find it. Maybe search for the word podcast on your phone to see what's available, PODCAST. You likely already do have an app there that you can use to search for Paso a Paso podcast, which is this program right here. We will continue into 2021, providing episodes as often as possible. And may decrease a little bit, but we're going to keep the conversation going either way. Lastly, we would love to interview you. If you are a listener, a member of our community or region here in northern New Mexico, and you'd love to be a guest on this podcast, Paso Taos, pasotaos@gmail.com.
Paso a Paso
Podcast.